All right, folks, lasers are an incredible tool in the facial rejuvenation and skin rejuvenation toolbox, but can they replace a surgical facelift? You're gonna find out in this video.
Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and curator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're gonna talk about a very, very basic but very misunderstood topic, and that is, what's the fundamental differences between lasers for facial rejuvenation versus a facelift, right? Because I tell you, I hear this concept being used not just interchangeably, but as an alternative all the time. And I want to help you understand where lasers fit in and where facelifts fit in and what are the important distinctions, right? So here's what it comes down to. As we age, a series of hormonal changes start to happen. Typically in our mid-late 40s, we start to see changes in our appearance. We start to see jowls and laxity starting to happen along our jawline, our neck starts to sag, our eyes start to get heavy. All these things are sort of happening. That's when everyone starts to hit the panic button. The market becomes your savior. You start looking for opportunities and ways to address this. You as a consumer, you've got a lot of different options in front of you. And one of the most popular options and kind of sexy options is the option of lasers. Lasers is basically the concept of using very focused light at different wavelengths to achieve certain things. There's a variety of different lasers. There's a CO2 laser, there's an erbium YAG laser, there's the pulse dye laser, there's IPLs and BBLs, although those are not true, lasers. There's a number of them that are used in facial rejuvenation and cosmetic surgery. And nowadays, there's all the different red lights and things, again, not true lasers, but they are certainly in the category of light being used. Let's just kind of put it in perspective. Why is your face sagging in the first place? Because knowing the why behind it will help inform a lot of decisions that go forward. There is a layer underneath the skin called the fascia. The fascia holds the whole face up. It's literally like a corset that holds the whole face up. And when you're young, that fascia is tight. You get the firm jawline, the tight neck, and eyelids and everything look young. And as you age, these start to unravel and they start to get longer. And that elongation of the fascia is what causes everything to sag. Now, where is the fascia located? Well, I said it's underneath the skin, but it's not like right underneath the skin. So you've got the skin, and the skin on the face is usually 1 to 2 millimeters in thickness. Then you've got a layer of subcutaneous fat, which is underneath the skin that gives the skin kind of that supple softness. And then below that is actually another layer of fat that lives on top of the fascia, but really at the end of the day, let's just call it fascia right there. That's where that is. And then below the fascia, you've got things like nerves and important arteries and all this other stuff. We're talking about 6 millimeters, sometimes a little bit less, sometimes a little bit more, depending on how thick your facial fat is. Below the skin is where that fascia lives. Most lasers, especially like CO2 and erbium, the ones that are really popular that you hear about, because why are they popular? First of all, they've been around for a long time, but they're also used in a lot of the big name procedures like profractional halo, contour TRL. Those use erbium YAG, but then you've got a lot of different types of active FX and Fraxel and all these that use CO2. And what happens there is you are applying the laser, which is like microns deep. Microns, how should I explain it in a simple way? It's like less than a sheet of paper is how thin it is. I mean, that's the penetration depth that you get with one of these type of lasers. Depending on the settings and depending on circumstances, you're gonna get some heat involved like you do with the CO2, so there's a little bit deeper penetration from the heat, but the actual laser doesn't make it anywhere near the fascia, anywhere near. The point is that when you use a laser like the CO2, you go get a Fraxel, you go get an active FX, you go get contour TRL, you may hope and desire that what you're getting is something that's going to tighten up your face, because why wouldn't it? You're tightening up the skin, right? I mean, that's the whole idea of the laser. Well, not really. Lasers resurface the skin. CO2, erbium, they're resurfacing the skin. When you use some of the other ones that I mentioned, the pulse dye and the BBLs and IPLs, those are breaking up pigment. They're not doing anything to tighten anything. So what ends up occurring is obviously, right after the laser, the skin's gonna be a little swollen, so a lot of the fine lines and wrinkles will be gone, and things might look like they've kind of tightened up a little bit. But as soon as 3 months go by or so, 6 months go by, and everything kind of relaxes a little bit because of the swelling, the laxity is exactly what it was. And it should be. That's not the point. That's not the purpose of the laser. It wasn't meant to be. It's meant to take away sun damage, fine lines and wrinkles by resurfacing, kind of like sanding the surface of the skin. So that's why you use a CO2 or erbium YAG laser. And here's the other caveat. CO2 by itself causes so much thermal injury, meaning the whole face turns into like this big swollen looking mess. And it takes oftentimes weeks, if not a month or two, to fully settle down. Full field CO2 resurfacing, which was very, very popular at one point, has almost completely been eliminated as a treatment option. Now, all the lasers that I just mentioned, the Halo, Profractional, Active Effects, and the other ones like Fraxel, etc., those are all what are called fractionated lasers. That means if you have a sheet of paper, there's dots of lasers being presented on them, and usually it covers about 15–20% at most of the entire surface of that sheet of paper. You're not getting laser all over the place. So it becomes even less effective, but the upside is that you don't have long recovery like you do with the deep resurfacing, which no one in today's day and age can go through that type of recovery. So CO2 lasers and cousin of them, the erbium YAG laser, is a resurfacing laser. On the flip, what are facelifts? Facelifts address the fascia. They actually get into the layer where the fascia is, lift up the fascia, tighten up the fascia, shorten the fascia, and as a result, shorten the face and improve the shape and contour. Now, the caveat is, as you all know, there's a lot of kind of weird looking facelift results out there. It all just depends on how the facelift is performed. Obviously, I present my outcomes here. I use a technique that I'm very proud about. It's a vertical restore. It produces very natural looking results. That's why people love it. But my point though is reshaping in the face is achieved with a facelift or surgery. It's not achieved with a laser. Now, what are you giving up in this situation? Well, with a facelift, you're not doing anything to refresh the skin. If you think about what a young person looks like, a young person has young looking skin and they have young looking facial shape. So a lot of times I will combine a laser, like a CO2, but in my case I use an erbium YAG. I combine a laser resurfacing plus a facelift to bring the person into balance from a overall rejuvenation point of view, so I can improve their skin and their shape. And I always, always, always have patients recognize the fact that the laser treatment is never going to be permanent in order to continue the impact. And this is so important for you guys to recognize this, because I know a lot of you guys like to do lasers and go out and do different types of lasers. The lasers are great, but there need to be bookend with daily skincare. It's just a simple reality. If you don't do the skincare and sun protection part of it, the effects of your laser or chemical peel, whatever, will start to diminish over time. It's just what happens. So if you want your skin to actually get better and better, after you do your laser, you stay on active skincare. And you all know I developed a product called the Trifecta, which is a bunch of active skincare ingredients all together to make it really simple to do. The point is that's what you need to do as part of the laser story. With surgery, hopefully if you get a properly done surgery, you're done for a very long time. So this is not something actively you have to do ongoing. But bring those two together, you've got two sides of the coin, skin and shape, and you've got the outcome. They don't replace each other, they don't overlap with each other, they don't do each other's job. They're parallel parts of the facial rejuvenation approach, and they have to be treated as such. So for those of you who are out there hoping that you can bypass having surgery done, getting a facelift done by doing lasers instead, you're not getting anywhere. I promise you that. You are improving your skin, which is a beautiful thing, but you're not changing the way your fascia starts to sag and slowing down the shape part of aging, which is the thing that I think fundamentally bothers people more so, because you start to look unrecognizable to yourself. Right? So I hope that helped. I hope that put it into perspective. They're both excellent, excellent tools used for different problems, skin and shape. All right, folks, I hope you Learned a lot. I hope that put things into perspective, give you a better idea of what to do. And like I always say, when it comes to this particular topic, if you can't do a facelift or you can't find a facelift surgeon that you're completely comfortable with, honestly, don't do one. Don't do anything, in the realm of trying to improve the shape of your face. Don't do, all these energy devices like Ultherapy and Morpheus and all that other stuff. To try to get you a facelift result, because you never will. Enjoy the aging process for whatever it is, and you're going to come to terms with the fact that if you don't want to do one, it doesn't mean that you can replace it with something else, because at the moment there is no replacement for the effects of a facelift. There just simply isn't. But there is definitely a beautiful combination of things that can be done to improve your skin, but it starts with sun protection, then skincare, then your lasers and chemical peels and the things that you can do in the office. I hope that puts things in very clear perspective to give you the empowerment to be able to drive forward and do the right things for yourself and feel like you made good choices. And if you haven't already, make sure you hit subscribe, you share this with some friends and family, give me any feedback you'd like or any questions you have down in the comments. And until next time, Dr. Amir Karam. Thanks so much, guys.